APIC.org celebrates International Infection Prevention Week, October 20th through the 26th. The week provides a focal point for infection preventionists and healthcare professionals to shine a light on infection prevention and its power to save lives. Certain infections can cause hearing loss at any age, and one of the most common culprits is bacterial meningitis. DeafWebsites.com reports that over 30% of bacterial meningitis cases result in some degree of hearing loss, from mild impairment to profound deafness. In a 2006 study, it was found that over 3% of American youth with hearing loss had suffered meningitis, making the infection the second most common cause of hearing loss. Paige Holt, Doctor of Audiology at Lake ENT, explains that infection isn't the only cause of hearing loss.
Most of the time when a child has hearing loss that's associated with ear infections, it can be easily corrected. We see children that have tubes. We see children that sometimes have to have 3 or 4 sets of tubes. Occasionally there might be some scar tissue from years and years of infection that goes untreated and really neglected, and then we can see a mild hearing loss that again can easily overcome through amplification. There are basically 3 types of hearing loss. There's what we call nerve loss, and the fancy term for that is sensory neural hearing loss. That is basically degeneration of the hearing nerve. The most common causes of degeneration of the hearing nerve are aging, exposure to loud noise, and family history can contribute. And that is permanent. We usually see that in your mid-50s or 60s, and we can correct that by way of hearing aids. Another type of hearing loss will be what we call a conductive hearing loss. Conductive hearing loss is what we see when usually we can have some medical intervention, and we would refer them to the physician for a conductive hearing loss. And then there is a case where we have what we call a mixed hearing loss. Part of the hearing loss is due to degeneration of the hearing nerve, part of it is due to a medical condition on top of that. And so how that would be handled is we would refer them to a physician for medical treatment to bring the hearing back as much as we can, and then we would correct the remainder of the permanent hearing loss with hearing aids.
We've included links to International Infection Awareness Week, as well as more information on meningitis and contact information for Lake Ear, Nose, Throat, and Facial Plastic Surgery when you follow the Infection and Hearing Loss Story Link icon on our homepage, yourhometownhealth.com.